Hello. Are you 65 years of age or older? Have you been vaccinated for Streptococcus pneumonia? You've probably heard of the influenza shot to prevent the flu, but maybe you haven't heard of a shot that is just as important. Streptococcus pneumonia causes more deaths each year in the United States than all other vaccine-preventable illnesses combined. This is why you need to know about the pneumococcal vaccination. You may have heard this called a Pneumovax or Prevnar. It can and will save you time, money, and maybe even your life. Over 900,000 people out in the community get pneumonia each year, and over 400,000 people are hospitalized from these infections in the U.S. alone. Besides life-threatening pneumonia, these infections can also cause meningitis, which is an infection around your brain or spinal cord, or infections in your bloodstream. In these cases, bacteria have reproduced, multiplied, and are invading your brain, spinal cord, or blood. These diseases can cause serious illnesses and lifelong complications like hearing loss, seizures, blindness, paralysis, severe heart problems, and potentially death. Pneumococcal pneumonia, meningitis, and bloodstream infections kill tens of thousands of people each year, including 18,000 adults over the age of 65. In people over the age of 65 who have contracted this illness, 1 out of every 4 of them will die. Most of these deaths are preventable. 18,000 adults is the equivalent of a Boeing 747 crashing about once a week. Getting vaccinated is the easiest and cheapest way to prevent these kinds of infections and the burden it causes for you and your family. Currently, the Center for Disease Control recommends that everyone over the age of 65 receives these vaccinations. If you have underlying medical conditions such as asthma, COPD, diabetes, heart failure, liver disease, or if you drink alcohol or use tobacco, you are more vulnerable to these infections and prone to serious complications. Vaccination is essential to your survival. However, even if you have been told you're in good health, it is still recommended that you get these vaccinations. Vaccination is the best way to prevent pneumococcal infection. There are 2 vaccines approved to prevent these infections in the United States. These are the PCV13, also commonly known as Prevnar 13, and the PPSV 23, also commonly known as Pneumovax 23. At the age of 65, it is recommended that you receive the PCV 13 shot, and 6 to 12 months later, you should receive an additional shot of the PPSV 23. Talk to your healthcare provider about the appropriate schedule for you. These vaccines are made from pieces of killed bacteria and cannot cause any of the pneumococcal diseases. The most common complaints after one of these shots are redness, swelling, and pain in the area that it was given. In extremely rare cases, a severe allergic reaction may occur. These vaccines are covered by private insurance and Medicare for no cost or a small copayment, and are usually available at your local pharmacy or healthcare clinic. This pneumococcal vaccine can be given at the same time as the flu vaccine or any other vaccine for your convenience. These vaccines are effective, available, and are provided at minimal cost. However, only 60% of seniors are vaccinated. You didn't 60% land on the moon. You guys 100% landed on the moon. Now it's time to be 100% vaccinated.
Created using Powtoon.